Hi, I'm Sam Sacasa from NAVC's Vetfolio and the host of this Vet2Vet Tech Takeover. Procedural sedation has become the standard of care in many practices, and it's no wonder why. From increasing patient and staff safety to improving the overall experience and quality of care of our patients, the benefits cannot be overstated. Our guest today has some great tips on incorporating procedural sedation in your everyday practice. Sarah Stahlman is a registered veterinary technician with a special interest in anesthesia and analgesia. She works in the anesthesia department at MedVet Columbus, an emergency and specialty care hospital in Ohio. She is a fear-free certified professional and strives to create a safe and caring space for pets and their people in the veterinary hospital. Thank you for joining us, Sarah.
Hi, thank you for having me.
Okay, so let's start with the basics. What exactly is procedural sedation?
Procedural sedation is exactly what it sounds like. You have a task that needs to be done, maybe a diagnostic or a small procedure like a mass removal or maybe a pin removal, something quick, but you need the patient to sit still. So we give drugs in order to facilitate that.
Okay, so with that in mind, why do you think that there is a need for procedural sedation, and why do you think it's become so much more popular over time?
There's definitely a high need. It's difficult in veterinary medicine to ask our patients to sit still for a longer period of time. It also helps to keep the visit experience for the pet as well as the owners and our staff a lot more fear-free, a lot more efficient, as well as we can get by better diagnostics the first time around rather than trying to take multiple, for example, radiographs or having to repeat studies just because we didn't have a compliant patient, which also puts a lot less stress on your technical staff that wants to create the best diagnostics for their veterinarians.
I love that. I think that you touched on so many important points, and I think sometimes we associate it with just dogs that are maybe particularly stressed out or fearful, but I think that a lot of what you mentioned would apply to so many of our pets. So you mentioned what procedural sedation is and why it's important. What are some of the drugs that are used for procedural sedation?
There are many drugs that we utilize that can range from acepromazine, ketamine, midazolam, dexmedetomidine, a lot of these and opioids too, used in combination. Some of them more reliable sedation than others. So, for example, acepromazine and midazolam and opioids by themselves are not great sedatives, but in combination work really well. And then there are drugs like dexmedetomidine that have great, reliable sedation that, you don't really want to use in geriatric patients with multiple comorbidities. There are a lot of drugs that have side effects that we are trying to lessen by using more drugs in combination.
Well, you touched on a lot of different drugs, and I know that these drugs can affect patients differently. So let's talk about patient safety. What do technicians need to keep in mind when sedating a patient in order to keep that patient safe?
Definitely keeping in mind normal vitals for that species, as well as being prepared for worst case scenarios, monitoring heart rate, respiratory rate, potentially being ready to intubate or provide flow by oxygen, as well as potentially blood pressure monitoring, depending on what your heart rate is doing, especially in instances where you've used a combination of drugs.
I'm glad that you mentioned all of that, being ready for an emergency. I know that when I first started, procedural sedation was sort of shied away from, right? Because, of course, there's always risk, but there's definitely ways to mitigate that risk, and there are so many benefits. So I think that that's really important to keep in mind.
Right. And even there's that saying that's, there's no state safe anesthesia drugs, but only safe anesthetists. So it's really on the technicians watching the vitals, watching, being prepared, is definitely a huge part of our job.
Absolutely. Okay, so I'm going to ask you a question that's near and dear to my heart because when I was a baby technician, I got bit by a dog pretty badly that was on dexmedetomidine. And so I wanted to talk a little bit about technicians' safety, specifically the excitatory phase that we sometimes see when dogs are sedated. How can we prevent this? Because now that I've been a technician longer, I know that it probably could have been prevented. And I just think that this is important to share with technicians.
Right. And that is an incredibly scary situation to be in because you're not expecting it. But
Hmm.
the important thing to keep in mind is that procedural sedation is not general anesthesia, and that, creating an environment that is quiet and calm, letting the other staff in the hospital know, hey, we have a sedated procedure going on in this area for, this amount of time. We need to be at a lower level, calm. Also keeping in mind too that the pet still has a lot of auditory stimulus. So sometimes taking away their sight, covering their eyes can be helpful, or putting, cotton balls in the ears. Just don't forget to take them out. And then just sort of helping create a safe space for the pet will then help create a safe space for the technician that is monitoring that sedation.
Absolutely. I'm really glad you shared that because that's definitely something I think all technicians need to know. Okay, I know that you practice a lot of procedural sedation. So, what drugs are you specifically using and why? What benefits do you get from that?
One drug that I'm super excited about using and use quite frequently in the past year is Zenalpha. We use it a lot at our hospital for simple radiographs and simple procedures, but the most that I use it for is our steroid epidurals. And so we will bring in a patient from our neurology department. It's just a quick drop-off procedure. They've already had their MRI and diagnostics, and they come in and they don't necessarily need an IV catheter to do a full procedure. We just need to give them a quick intramuscular injection and then administer the steroid epidurally. So we really need them to sit still while we place this needle right into their spine and administer drugs. So we have been using Zenalpha a lot. It's quick and easy as far as you see the dosing chart. It's very comfortable. You have the dog's weight and you just see the weight comparison to the volume, and that's the volume you're giving. So it's very easy as a technician to not have to recalculate doses and make sure that I'm giving the right dose. And then two, it's very efficient in that I'm not trying to place an IV catheter and then have the patient go through all of that just to give them an injection. And it's actually Zenalpha works so quickly. I did one last week that I timed my injection to when he was lateral was 7 minutes,
Oh,
which
wow.
was pretty amazing. Especially considering I think the prep time and placing a catheter and taping it all in was probably that same amount of time, depending on this patient, needed to be muzzled because he doesn't like his feet being touched, and he was obviously fearful. So it really facilitated a smooth experience for him. And it's such a quick procedure that we then just reversed with antecedent, and he was up and walking and out of the hospital in an hour. So quick procedures like that using Zenalpha, the heart rate is more at a reliable, um, stable rate, especially when you compare it to their resting heart rate. And I even put on a blood pressure cuff for that procedure and just making sure that we weren't extremely hypertensive, like what you would see with dexmedetomidine, you'll see an increase in your blood pressure and then a reflexive bradycardia. Whereas with the Zenalpha, it's, heart rate maybe of 70 and my MAP was 100. So it makes me feel really good as a technician that I'm not like, oh my gosh, we're in the scary zones, but it really makes a great experience for me and the pet.
That's awesome. And I know what you mean about the scary zone where you're like, oh, I know this is probably normal, but is it okay? Like, at what point do I start to panic? So that's a really nice benefit, I think. So you talked so much about how the increased efficiency that you've seen with Zenalpha, how you were able to do that procedure in 7 minutes. How do you feel like this benefits you and the patients?
It really benefits both of us because this patient, we know they don't, most patients, besides from like maybe a happy, golden retriever that loves seeing everybody, they don't want to be in the hospital. There's weird smells. They just want to get out. So making it a quick experience for them, an experience where we're not wrestling or, causing a ton of pain is great. And then two, for the clients, they don't want to spend their day sitting in our lobby waiting for their pet to wake up from heavy sedation. So having it be a quick procedure as well as a quick reversal is pretty great.
Well, I know that you work a lot with sedated patients, so I wanted to see if you could give us some advice on how veterinary technicians can become more comfortable with drugs like Zenalpha and just newer drugs in general, because I know that a lot of times that can feel really weird at first using a new drug.
Right. And it is, but the thing to remember too is reading up about the drug, making sure that you're using it on label,
Hmm.
um, and talking with your doctor because the veterinarian and technician jobs are very codependent on each other. So being both of you being open-minded and being willing to talk about a drug and even learn together is great.
I love that. I think that's really great advice. Well, Sarah, thank you so much for joining us. Do you have any closing thoughts for us today?
Don't be afraid to try new things and advocate for your patients, and keep learning and keep up on the new drugs.
Thank you, Sarah. And thank you to Decra for partnering with us for this Tech Takeover edition of Vet2Vet. Check out nabcsvetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, patient care starts with self-care.
Important safety information. As with all drugs, side effects may occur for use in dogs only, not intended for use in cats, not for use in humans. Avoid skin, eye, or mucosal contact. In case of accidental oral intake or self-injection, seek medical advice immediately and show the package insert to the physician. Do not drive, as sedation, loss of consciousness, and changes in blood pressure may occur. People with cardiovascular disease and pregnant women should exercise special caution to avoid exposure. Uterine contractions and decreased fetal blood pressure may occur after accidental systemic exposure. As with all alpha-2 adrenoceptor agonists, onset of sedation may be delayed or may be inadequate in some dogs. Do not use Zenalpha in dogs with cardiac disease, respiratory disorders, shock, severe debilitation, that have hypoglycemia or are at risk of developing hypoglycemia, or are stressed due to extreme heat, cold, or fatigue. Zenalpha should not be administered in the presence of pre-existing hypotension, hypoxia, or bradycardia. Due to the pronounced cardiovascular effects of alpha-2 adrenoceptor agonists, only clinically healthy dogs, American Society of Anesthesiologists, ASA Classes 1 and 2, should be administered Zenalpha. Dogs should be monitored frequently during sedation for changes in heart rate, blood pressure, respiratory rate, and body temperature. Tachycardia may occur in some dogs after recovery from sedation. The following adverse reactions have been reported: diarrhea, muscle tremors, and colitis. Refer to the prescribing information for complete details or visit www.decra-us.com.